Well, good morning. I'm Patrick Erickson with the Inland COVID Response Joint Information Center. We appreciate everyone being with us, and we apologize for our slow start or a late start. Now, this morning we will have our daily update from Spokane County Health Officer Dr. Bob Lutz. He will also be addressing this morning questions we've been receiving related to COVID-19 and its response. And as always, if you have any questions for the doctor, please share them with us right here on Facebook. We'll try to get to as many as we can this morning. With that, we will start with Dr. Lutz.
Funny. Good morning. You may notice I have a new mask on today. I really want to thank Mrs. Dickinson, Katie's mom, for my new mask. I didn't quite know how to take it off, so excuse me. So we're just going to start off with some numbers and then go into the facts. So let's look at the first number. The first chart, as I continue to reiterate, we are definitely slowing things down. We do have 5 new cases, which brings our number up to 322. We've had no more deaths over the past few days, which is great. And currently we have 13 individuals hospitalized. So those are the numbers, and let's talk about some of the facts, some of the questions that we continue to get asked. The first question is, can people catch COVID twice? To the best of our knowledge, no. That said, there is some question because we have seen some situations whereby people seemingly get better and then they get worse. So if you've had colds before, you know that you typically may get a cold in one season, but there's lots of cold viruses out there. Likewise, there are viruses like a cold sore virus, where you may get it once, and then years again or months again, it's reactivated. What we think may be happening with COVID-19 is that rather than reactivation, which we typically don't see in COVID viruses and coronaviruses, what we do see, however, is what's called resurgence. That for whatever reason, the body's immune system is able to fight it off, fight it down, push it back, and then it has a recurrence, it has a resurgence. And so not so much a new infection, but rather the original infection just never fully went away. So to the best of our knowledge, and we talk about this being a novel virus and learning a lot about it, to the best of our knowledge, you cannot catch COVID twice. Second question, clarification of what is immunity and what does asymptomatic mean? Immunity is simply the fact that once your body has been exposed to an infection, you develop to some degree immunity. And that's going to vary. That's going to vary based upon a lot of factors, both age, medications, any other medical problems that you might have. Generally speaking, we tend to think that younger people have a stronger immune system than those of us as we get older, but that's not always absolute. Either way, immunity is your body's ability to, once exposed to an infection, to prevent you from getting that infection again. Asymptomatic is very different. It simply means that you have the infection, but you have no symptoms. So asymptomatic, it's a medical term. It just means without symptoms. So immunity, your body has been exposed, you've been exposed to an infection, your immune response is now fighting it to prevent you from getting it again. Asymptomatic, no symptoms. Can you get COVID-19 from a blood transfusion? No. We know that respiratory viruses such as COVID-19 are transmitted by both, in this case, respiratory droplets, which are larger particles that occur when you are coughing or sneezing, and there is evidence that it may actually be aerosolized. These are much smaller droplets that may be occurring. But again, what happens is when you're exposed to those particles, you touch your face, the particles get to your mouth, to your nose, to your eyes, and that's what causes the infection. There's no evidence that these respiratory infections can be transmitted by blood transfusions. And I emphasize that because we continue to hear about the concerns about our supply of blood for surgeries and for trauma. And so if you haven't donated blood and you're concerned about donating blood because of infection, I encourage you to do so. My wife actually went and gave blood 2 weeks ago. So thank you, Amy, for doing that. And finally, was COVID-19 transmitted, or I should say, was COVID-19 created in a lab? There has been some theories proposed that this is a laboratory creation. I heard, for example, that it was named COVID-19, indicating that there were 18 other versions of this. Incorrect. It's called COVID-19 because the virus was first identified in the year 2019. Again, there is no evidence that this is a lab-produced virus. Rather, we know that these coronaviruses are commonly found in bats. And what was identified actually many years ago, this virus was actually identified, but it had not been transmitted to humans. What we see is that this virus that was now COVID-19 identified is the same virus that was identified in China in basically DNA or RNA analysis. So this is not a man-made virus. So with that, I'll open it up to other questions.
Well, we have a viewer right now that would like to know, Dr. Lutz, if you could speak to how much testing we need here both locally and statewide so we can finally start to loosen some of those precautions and regulations in place.
Right, so we talk about, Governor Inslee has recently used the phrase boxing in the virus to the idea that we are going to require more rigorous testing, and therefore once we have adequate testing, we'll have a better sense of who is infected. Infected individuals would then be placed in what's called isolation, which means that you are separate from others so that you are not infecting others. And individuals who may have come in contact with you are placed in what's called quarantine. So testing, ongoing question, ongoing conversation, we still don't have enough. So for example, when I looked at the numbers most recently, we've performed maybe 7,500 tests here in Spokane County. Across the state, I forget the exact numbers, but over a couple 100,000. We're a far cry from what we need to do. There are projections, and I apologize, I don't have the numbers in front of me, but there are a projected number of tests that would need to be done on a regular basis. On average, we're doing maybe about 4,000 tests a day. The desire is to do between 20 and 30,000 tests per day. We do not have that capacity yet in any laboratory. We do not have the capacity at this point with respect to testing materials. I was informed, however, that the Department of Health laboratory did receive 100,000 test kits yesterday, and they will be looking to be distributed. So we're still not there yet. This is a local, regional, and national shortage issue, which unfortunately has placed us in the position we currently find ourselves in.
Dr. Lutz, similar to the shortage issue, could you give us a picture of what our hospitals are facing in PPE right now? Do hospitals have the N95 masks that they need right now, the protective gowns, other PPE that is essential? What is the current outlook for PPE for our hospitals as of right now?
Yeah, so with respect to supplies, I'll just call it stuff. Locally, I think our hospitals are very well equipped with their personal protective equipment. Early on in this pandemic, we were concerned about PPE shortages at our local hospitals. That has been addressed, and I'm very encouraged by what is available. What we see, however, across Eastern Washington, especially in what we call critical access hospitals, is that where they have smaller numbers of patients that they see, they are the life's blood in many communities to provide health care. And those hospitals may not always have as much PPE as the larger institutions have. I was informed that recently there was some funding that was allocated specifically to those small hospitals in Eastern Washington, which is really important because we need those hospitals to be able to do the work that they need to do, and PPE is part of that conversation.
And Dr. Lutz, we have another question from a viewer. It now seems there's been a change from slowing the spread to now trying to stop the spread, preventing healthy people from getting the virus. How will we ever have herd/social immunity?
So early in an epidemic or a pandemic as this is, the term that we use is containment. And so we are trying to contain the virus and prevent it from spreading. We can try to control it. As we unfortunately know, however, we got started very late in this process, both at the national, state, and local levels. And as a result, we went quickly to what are called mitigating efforts. So all of those recommendations early on about physical distancing, about washing your hands, about isolation, those are all mitigating efforts. Those were put in place primarily to ensure that the healthcare system wouldn't be overwhelmed. Because if the virus were to spike and we were to get a large number of people who were either very, very sick and or requiring hospitalization, going back to that surge concern, we wanted to ensure that that surge never happened at the hospitals, and thankfully we were able to prevent that. What we are looking at now doing, which as I mentioned earlier is what Governor Inslee refers to as boxing in the virus, we're trying to identify those individuals who are infected and in doing so prevent them from infecting others. Now there's a balance here because herd immunity requires a large percentage of individuals to actually be immune to the infection. We are not going to be able to achieve herd immunity by the current process, and that's just a reality. So what we're looking at doing is trying to identify as many individuals as we can, prevent them from spreading the infection, and this is in a holding pattern. This is in a holding pattern until we get a vaccine, because at this point that really is going to be what's going to be essential to ensure that enough people are immune to COVID-19 to prevent them from transmitting it more readily, which is where we are right now.
And we have another question, this one coming from one of our media partners. We're hearing from people who were diagnosed with the flu in January and early February who say their doctors are now saying it could have been COVID. Could that be a possibility, and what do you make of that determination?
Yeah, it's a great question. If we look at the fact that the first case that we're aware of in Washington State and nationally was that individual who was diagnosed in the Seattle area at the end of January, and now we have evidence from California that it actually may have been circulating there earlier. We were not testing for COVID-19 back in December, January during the cold and flu season. And so, given that, it may have been that individuals went to see their providers because they had clinical symptoms that were consistent with flu. There was no testing, and therefore they were told they had flu, influenza, or maybe what we call influenza-like illness, which presents very similarly. And so that's why it was very difficult early on in this pandemic to differentiate between, is it the flu, is it COVID-19? And early on, our guidance to physicians and providers was test for both. Test for COVID-19 and test for influenza. And if you can test for COVID-19, if you test for influenza and it's negative, then maybe assume that you are dealing with COVID-19. So as our understanding of COVID-19 has evolved, it's very possible that what individuals were experiencing during the traditional cold and flu season may have actually been COVID-19.
And we have another question, this one for you regarding modeling. What are you most looking closely at when it comes to numbers, and what numbers is the governor using to determine the rate of success right now?
So modeling is very complex, and it is based upon a lot of assumptions. Early on in pandemics, you plug in numbers based upon what you believe might happen rather than what is actually happening. Models are benefited with time, because as you go through the process, you actually have real data rather than assumptions driving the decision. So that's why early on you heard at the national level, they were talking about hundreds of thousands of deaths, very high numbers. Subsequent modeling based upon real data demonstrated those numbers may be less. At the Washington State level, the same modeling that has been used to describe the national response has also been informing the governor on what the statewide response is. And I'll share with you that most of those data are based upon where we have seen the highest rates being in the Puget Sound region. And what we have seen is that based upon data, both assumed at the beginning of the pandemic and now projected out, that we are looking at having already seen, to some degree, a peak in Western Washington, a peak across the state, and again, the projections are looking encouraging. So the governor is using modeling that's being used at the national level and at the state level to guide his decisions.
And another question, how many of the new cases, if you have this information, have been gotten or received from family or close contact of previous positive cases? Is that something that is being tracked right now?
Yeah, so I think that speaks to how people actually can track the infection, and this is all what we call part of the contact investigation. Early on, we know that the recommendations were that the questions were, had you traveled to China? Had you traveled to some place where we knew the virus was occurring? We were looking for what are called epidemiological links. That's where we can actually make a tracing. So this person knew that person who had the infection, and that's how he or she got it. With community spread, that's again something that we are doing. That's part of what our contact investigations. As to whether the individual got it from family members or friends, we sometimes don't really know that unless we are testing other family members. So for the most part, what we know, what we've been saying for weeks now, is that the virus is in the community. You may be getting it from family members, but you're getting it from people that you've been in contact with. From what we know with coronavirus, we're saying that it's that close contact, it's that contact for a prolonged period, up to 10 minutes, that really is why people are getting infected.
And this viewer would like to know, at this point, should high-risk people get tested if they have minor symptoms like a runny nose, occasional cough, and no fever?
So the question about guidance for when you should be testing, this is definitely evolving as we've learned more about COVID-19. And per a conversation that I had with Department of Health and the state health officer over the weekend, I believe that there will be new guidance that will be presented this week to healthcare providers across the state that liberalize recommendations for testing. So for essentially anybody who comes in with symptoms that include headache, sore throat, shortness of breath, cough, fever, flu-like symptoms, the recommendations are that providers should consider strongly testing individuals for COVID-19. So those guidelines are again forthcoming from the Department of Health, and we hope to have those presented to the entire Spokane community this week.
And I believe we've touched on this briefly. There was reports of a couple of domestic cats that tested positive. Should we worry about domestic cats getting COVID? Do you know why some cats are tested for COVID-19?
Yeah, that's an interesting question. The cats that I know of were hardly domesticated. They were actually tigers. So those are the ones that I've heard about. They were in the Bronx Zoo, I believe, a couple of weeks ago, and they had taken ill, and a veterinarian suggested testing for COVID-19, and they tested positive, as were other cats in that facility. I'm not familiar with domesticated cats testing positive for COVID-19, so.
And this will be our final question this morning. We have another viewer that would like to know, how close are we to an accurate antibody testing and any data on the length of any acquired immunity from the disease?
So with respect to antibody testing, we've touched on this in the past. There are a myriad, I want to say more than 80 from my last count, of quote-unquote FDA approved via what's referred to as emergency authorization use antibody tests that exist out there. That said, of those approved, and I put that in quotation marks, only one is currently at the laboratory level being evaluated for both how valid it is, meaning how accurate it is, and what does immunity mean. So as we touched upon earlier, immunity implies that you have been exposed to an infection and now your body can adequately fight it off. What amount of immunity allows you to not get COVID-19 again? We don't know. Can you get COVID-19 again? To the best of our knowledge, no. But again, it's a novel virus. We don't know. So there is no antibody test currently available, and to test whether somebody has been immune to COVID-19. It is our expectation that we probably will not see an antibody test for weeks to months, but again, it's evolving, and so stay tuned for that. And then the second question?
Let's find that again.
Sorry.
Hold on a sec.
I think it's just about antibody.
Yeah, data on length of any acquired immunity from the disease.
Okay, and that again speaks to why it is being studied. It will probably be years before we really understand how long someone is immune to COVID-19. If we use other coronaviruses, what we see typically is that people have an immunity that lasts in the order of years, very much based upon that individual's immune system. But in general, if, for example, what we've seen with the SARS coronavirus, the MERS virus, is that people have an immune response 2, 3, 4 years afterwards. Our hope is that the immune response to COVID-19 will be that and more.
And we do have one final question, very quickly. A person who is immunocompromised, when will they know it's safe to go back to work? This person has been off work since the beginning of this and wants to know if and when a person who is immunocompromised will be safe to go back to work.
That really, again, speaks to the guidance that the governor has put forth around stay home, stay healthy. All individuals who are high risk, such as this individual who's immunocompromised, there's no indication right now that that person should venture forth and back into the workspace. This is all part of the very phased-in approach of reopening the community, reopening the state. But for that individual, unfortunately, he or she is going to have to wait until we really feel comfortable and confident that going into any space, be it a workspace, be it a business, is safe enough to not get infected. Okay. Well, we apologize about the delay. Thank you for tuning in. And as you know, I say, stay home, stay healthy, save lives, and wash your hands. Thank you, and we will see you tomorrow. Have a good day.